Hi, everyone. Can you all hear me okay?
Yes.
Great. Welcome to this session of medical imaging. My name is Tommy Nano. I am a physicist at the University of California, San Francisco, UCSF, in the Department of Radiation Oncology. I'm very excited to be here, and I wish we could have been doing this in person, but I have some very exciting information to share with you about medical imaging. And then we're going to play a little game at the end. And we're going to play a game where we're going to try and guess the toy in the ultrasound images. All right, so let's jump into it. Um, Medical imaging is almost like a superpower. It allows us to look inside the human body from the outside. It is very useful for doctors to try and have a full picture of a medical disease so that they can plan what the best medicine would be for each individual case. As you know, we are all different. Everybody is slightly different, and medical imaging allows us to tailor medication that is patient specific, and this improves outcomes and greatly benefits the patient. As you know, Superman has X-ray vision, and sometimes when I'm in the clinic, I feel like Superman when I get to see inside a patient's body. So I'm going to share with you some common type of medical imaging and how they work. So the first one is called X-rays. Um, Feel free to put your hand up or a thumbs up if you have ever had an X-ray of maybe your hand or your chest or your body or other body parts. Great. I see a lot of hands going up. Chest x rays are very common and they're used for trying to visualize any sort of lung or pulmonary disease. And this is what I'm showing here, an image of a chest x ray on the left. You can see the rib cage. So these are the bright lines that are showing up here. You can see the heart. So the heart is this part in the center. And then you can see the lung. The lung is the dark part in the center. And there are these small branches that come out into the lung, which are visible in chest x rays. On the right here is a chest x-ray of a hand, and you can see fingers, you can see the different bones that consist part of our hand. Um, X-rays are great for looking at bony anatomy. If there is a fracture, or maybe you have fallen off of a jungle gym and hurt your arm, it is very common to go to the hospital and get an x-ray of your arm to make sure that your arm is not broken. Um, so it's great for looking at bony anatomy. All right. Um, our next imaging modality is a CT. So X-rays and CT are similar in the way that they are both acquired with a low level of radiation. But an X-ray is a 2D projection. So the X-rays are going through the body and are detected as they exit out of the body. And that projection is what contributes to the image. Whereas a CT scan, it's many projections acquired together, and it gives us a 3D representation of our anatomy. So here is a CT scan of somebody's body. And it'll really, in addition to looking at the bone, which the chest x-ray does as well, we can start to see more of the soft tissue contrast. So we can start to see other organs, like here, what is going to start coming up are the kidneys. We can see the liver. We can see intestines. And we can also at the center here. Can you guys all see the CT scan as it's playing on the screen here? Maybe give me a thumbs up if you can. Awesome. Awesome. Has anybody had an X-ray or a CT scan before? Yep. Yep. Excellent. Okay. So now a CT gives you a 3D image of the body, and so does an MRI. Now, MRI stands for magnetic resonance imaging. And what we are looking at is usually water inside of our tissue. And because we're looking at water content in our bodies, we can start to see other parts besides bone very clearly. For example, this is an image of a brain, and you can see the brain very clearly. Um, you can see the ventricles in the center of the brain. You can see the gray and white matter that make up the brain. You can also see eyes, the orbits, um, and you can see a little bit of the nose as well. Um, so this is what a typical brain MRI image looks like. And the way an MRI works is completely different from a CT scan. So in an MRI scanner, there are large magnets, and these magnets make the water molecules spin in a certain way, and they point in a particular direction of the magnetic field. And as those molecules are pointing all in the same direction, we uh, we we poke them, and they all move together, and then we can get a signal from the way these water molecules move. And by playing clever tricks on how we excite these water molecules, we can create three-dimensional images like this one shown here. Um, if you've ever been inside an MRI scanner, you'll know that they're very loud. Um, you might have been asked to put on earplugs so that the loud noise doesn't disturb you. And all of that is part of the complicated system that is used to create these images. But an MRI scan is usually much louder than a CT scan. All right. Our next imaging modality is ultrasound. Um, an ultrasound image might have been the first picture that's ever been taken of you. When you're in your mom's stomach and you're a baby developing, ultrasound imaging is what's used to make sure that the baby is healthy and happy inside mom's stomach. So ultrasound imaging it uses sound, like the sound that you're hearing coming out of my voice. It uses that sound to produce these medical images as shown here. Um, a transducer, which is a probe which emits and detects the sound, uh, is used to create an image like this. So this is an image of a blood vessel, and as the blood flows through the vessel, we can create ultrasound images that indicate the direction of blood flow. Uh, Blue or red if it's going away or towards us. And this is a way of looking at not only structural information, which is kind of how our body is shaped, but also functional information, which is how our body works. Awesome. All right. The last kind of medical imaging modality that's commonly used is called positron emission tomography, or PET imaging. And I was mentioning structural information and functional information. Functional imaging is very commonly done with PET. And uh, PET imaging shows the amount of activity, like metabolism, for example, that your body is using during the day. So in this image here, this is a whole body CT and PET scan. And what we see that's really bright, which is showing in our PET image, we see the brain lights up and it has a very strong signal. And that's because your brain uses up a lot of sugar and it has a high metabolism. So in a PET image, a brain really glows. Other parts that show up bright in a PET image are the kidneys. As this PET tracer and signal goes through the body, it accumulates in the kidneys, and the kidneys appear bright. And when there is disease inside the body, disease will also show a high level of metabolism, and it will glow bright. And that is how PET imaging is used to detect disease at an early point. All right. Does anybody have any questions for me? Feel free to mute yourself or unmute yourself and ask any questions, or you can type them into the chat. Yeah, so you would get ultrasound when there is something that, for example, if you have some sort of pain in your stomach and it's kind of close to the surface of your skin, ultrasound is a great modality for looking at things closer to your skin. You can get ultrasound on your neck to see how blood flow is, how your blood flow is in your vessels or arteries. You can also get ultrasound, so a lot of abdomen, a lot of arms. It's a great way of very quickly getting information because ultrasound is easily accessible in most clinics. So that would be a way that you would get ultrasound. Now, a really interesting part of medical imaging is that, especially with X-rays and CT, is that we can't really see X-rays with our own eyes. They're invisible. But I'm going to show you a video where you can see X-rays from a CT scan. So in this video on the left, we used a special type of material called a scintillator, which when it's hit with X-rays, it will glow. So this image on the left here is every time you see that glowing, that blue light, that's actually, those are X-rays that are hitting that material. And as those X-rays hit the object, the image on the right, the X-rays that are detected are used to make the image on the right. As scientists, we have developed ways to visualize X-rays and not only detect, but now we can see where X-rays go, almost like Superman. Not quite, but almost. Great. All right, so I'm really excited about the fun part of our session, which is a live demonstration of some ultrasound images and seeing if you can guess which toys are in the ultrasound image. So I'm gonna stop sharing my screen, and maybe you guys can all spotlight, is it Phillips? Diane's? So you guys, I'm going to spotlight Diane's video on my screen. Hopefully it'll be on your screen as well. So Diane, could you turn off the background and also all right. Hello, can you guys see me? Yeah, we have a wave. Okay. So what I have here is an ultrasound system. And let me describe each component of this ultrasound system first. So this is our monitor and our software. It's basically a computer that will show us our ultrasound images in real time. The other important part that we have for our ultrasound system is our transducer. So this transducer will emit ultrasound and also detect it. And it does that very, very, very fast in a complicated way, and it is used to produce the ultrasound image that's available on the screen. So we have our transducer, and then we have our ultrasound system for viewing the images. The other thing that we need is some ultrasound gel. So for ultrasound imaging to show up very clearly, there has to be very good contact with the transducer to create something called acoustic matching, acoustic impedance matching. And what it means is that we want to go from water to water rather than water to air. So we have our ultrasound gel. And the next thing that we have is I have put some toys in here, which I will image with an ultrasound system. And then in the chat, if you know what toy I'm showing, please type it into the chat. So Diane is going to move her camera really close to the screen so you guys can see it. Let's see who can guess this one first. So our next animal. Can you hear me?
Oh, wait,
There we
yeah.
go.
This microphone's here.
Oh, perfect, perfect. All right, you guys are really smart. You got some smart audiences. Okay, so if you turn on the light, we'll show you that it is a giraffe. So this is a little plastic toy, and this is what it looks like in an ultrasound image. Okay, we're gonna step it up a notch. We're gonna get a little bit more challenging with our toys. So here's toy number 3. We'll turn off the lights. All right. So who can guess what toy number 3 is? Can you guys see that? Who knows what kind of animal toy number 3 is? I even gave you a little bit of a hint. I said it was an animal.
Is it a bear, Tommy?
Bear's a good guess, but it is not a bear. A bear's a good guess. We have, we will give people a few more minutes to take a guess. I can show it to you in another direction. I don't think this is that helpful. Rhino is also a good guess. Cow's a good guess. That's true. All right, let's show them what it is. So Diane's holding up. It's an elephant. So you can kind of see the big body and the long trunk there in the ultrasound image. Okay. All right, so you guys are really good. Okay, so I'm gonna step it up another level. We have another toy here, and let's see if you can guess what this toy is. Okay, let's turn off the light. Okay. Any idea what this toy is? Let's see if I can maybe show it to you in a better. Let's see, there's parts to it there. It's got another part there. I'm gonna get some more ultrasound gel on here. Oh, those are good guesses. Or we should give them a hint. Yeah, what would be a good hint? It's that it's not an animal, right? It's not the same as those other 3 toys from before. So this toy is actually not an animal.
Might be a video involved with a video game that you play.
It does involve a video game or a TV show that you guys probably know really well. All right,
You can catch them.
You can catch them all.
You can catch them all. Yeah.
All right, let's show them what this one is. This one's a little bit harder. Okay, so let's turn on the light. And it's actually, who knows which Pokemon this one is? Charmander. All right. So since we're with the Pokemon theme, let's see if you can guess this next Pokemon.
Squirtle.
Squirtle. All right. And let's show them the Squirtle. That's right. So this is what Squirtle looks like in an ultrasound image. If you've ever swallowed your toy, and a doctor might have to try and find it, this is what they would be looking at if you swallowed a Squirtle. All right, let's show them the third Pokemon. Maybe they know this one. This one's actually a lot harder, but if they guess the first two, they might be able to guess the third one. This one, see there in the center, it just looks like a bunch of blobs. It looks like a bunch of circles.
Feel free to unmute yourself.
Yeah. This one's pretty hard. Yeah, maybe here, there. This would probably be the best view of this Pokemon. It's a bunch. Charizard would be awesome. They're naming all the cool Pokemon. All right, let's show them this Pokemon. So, Bulbasaur. With a pumpkin. So maybe Diane, if you could point the camera towards the gel here. So this is what it looks like when we were looking at the ultrasound image. So I have the gel on top of the surface, and then I am moving the ultrasound probe and transducer as we are looking at the live image, which is over there. So as I move my hand, you can see that different parts of the animal become visible. And if I hold the phantom inside of you, that's where our toys were. So our horse and our elephant. So there's our horse. You guys can see the horse. There's the giraffe. You can see the giraffe. And there is the elephant.
Someone asked if the surface is covered with cellophane.
With, could you repeat that? With
Cellophane, like do you have saran?
No, so there's no saran wrap on the surface. This is actually gelatin, so it's kind of like Jello. So it's squishy and it's solid. You could do it with saran wrap and water, and if you had animals in there, but this is Jello. Although it's not delicious Jello, so I wouldn't eat it.
What's the gel for?
What's the
gel? The ultrasound gel.
Yeah, so the ultrasound gel is so that we can ensure that we get a good image. So we put the ultrasound gel on the surface of our probe, our transducer, and then when we make contact with the surface of the gel or the Jello, then it allows for the ultrasound waves to pass from the transducer to our phantom, our object here, without any sort of disturbance and without ruining the signal. Do we have more questions? Awesome. Okay.
You want to do it on?
Maybe not, but that sounds good. Okay, so I'll share my screen again. I share my screen. Okay, so that was our live demo. And let's just recap. So you guys guessed the horse. This is what a horse looks like in ultrasound. This is what an elephant looks like in ultrasound. It's a little bit trickier to see, but you can kind of see the top of it, and you can see the head and the what's the trunk of the elephant um, over here in the image. This is what a giraffe looks like. So it's really clear to see the long neck and the body, and then the head in the top. Um, and these were our Pokemon, which are hard to see. So we have our Charmander, Squirtle, and Bulbasaur. They're very tricky to see with ultrasound images. You have to be very skilled. And you have to be good at being able to take images with ultrasound. So at UCSF, we have a very skilled technologist that are able to get really good ultrasound images of our patients. I didn't show this one because I think this one's even trickier, but we have a race car in there, and this is what an ultrasound image of a race car would look like. Um, if I go back a little bit, you can kind of see like these little dark or brighter bulbs are the wheels, and this is the body of the race car. This is the head, and this is the back, the front and the back. But it's really hard to see very fine detail in ultrasound. Um, so, but it's fun. It's fun to try and play and guess what toy is stuck in ultrasound. So that brings me to the end of the session. I hope you learned a little bit about X-ray, CT, MRI, ultrasound, PET imaging, and thank you to everybody for playing the game with me. I had a lot of fun, and
Someone asked about,
yeah, is there any questions?
yeah, when do you use the different imaging?
Yeah, it's a great question. So each imaging modality has its strengths and weaknesses, and you would use them for a particular task. So, for example, ultrasound you would use for maybe superficial or some sort of surface imaging. So, if you're looking at the skin, or if you want a very quick uh, peek inside the body with a live imaging. Then your next sort of imaging modality that's very convenient is X-ray projections. So 2D X-rays, you would acquire them. Those are very quickly to acquire, and they would give you a sort of idea if there's like if you have a broken arm or if there's anything wrong with your chest or your lung. A chest X-ray would tell you. Then the next modality that you could use in to look inside the body would be a CT scan. So with the CT scan, you can get more information about the body, and a CT scan is useful. But it's not that great if you're looking at soft tissue contrast. So then to look at soft tissue contrast, you might want to use an MRI scanner if you're looking at maybe not bone. And then if you wanted to look at how my body is working, or how my metabolism is functioning inside my organs, then you'd use PET imaging for that.
What's the main ingredient of the gel? What is the main ingredient of the gel?
The gel, it's just called ultrasound gel. What would work great is also soap. So soap works would be a good substitute for the ultrasound gel. This gel that we're using is some that we've made up in our labs here at UCSF. Um, but soap is a good substitute for special ultrasound gel. Awesome. Okay. Thanks, everybody. Hope you have a great day.
Can we see that for what?
Oh, yes. We have another session at 12:30 called The Dancing Robot. So if you'd like to see more of UCSF radiation oncology, come to that session at 12:30 called The Dancing Robot. Thank you.